Vertigo is a symptom of an underlying disease. Suppose you have fever. Now, fever is a symptom. Vertigo also is a symptom, and we need to find out what disease it is representing in the body. Common cause of vertigo is diseases of the inner ear. Vertigo can be completely cured because if we find out the cause. Vertigo is a symptom of an underlying disease which is either in the inner ear, that is the vestibular part of the inner ear, or in the vestibular pathway, the nerve connecting the inner ear to the brain. Anything which occurs here, any disease which would interfere with the balancing of the system of the body would lead to vertigo, and vertigo is a symptom. Vertigo is, as I told you, is a symptom. For example, I'll give you, suppose you have fever. Now, fever is a symptom. We have to find the underlying disease, whether it is malaria, typhoid, tuberculosis, whatever. So, vertigo also is a symptom, and we need to find out what disease it is representing in the body. I think the first attack of vertigo should be taken very seriously so that we can nip the disease in the bud. That's very important, because once it gets delayed, the pathology inside gets established, and then it becomes very difficult to treat. Once we diagnose a particular cause of vertigo, the treatment is totally different. I'll give you an example. Like in benign paroxysmal positional vertigo, when there is stones in the fluid of the inner ear, specific maneuvers will have to be done to treat this condition. When the patient comes to us, we will have a detailed history, but today, more than detailed history, there are certain investigations which are very, very important. Investigations called the VNG, the Dix-Hallpike, the caloric, and the rotatory chair. All these would give us whether the person is suffering from one disease or multiple disease. For example, if a person is suffering from benign paroxysmal positional vertigo and also from vestibular migraine. So sometimes if we have not done all the investigations, we may just end up treating one disease and the other disease will not be treated, and this creates a vicious cycle. The other diseases then gives a lot of stress to the patient. The stress causes the first disease to come back, and then the patient doesn't become all right. So it is very, very important that all the investigations are done. I think NeuroEquilibrium is doing a fantastic job by giving us a wholesome picture of what's happening inside by its complete vestibular assessment. Vertigo can be completely cured because if we find out the cause, and if it is early, we can completely cure the vertigo. Stitch in time saves 9. There are many diseases which can be diagnosed very early. Please get yourself properly diagnosed and treat.